So why is Bengaluru India's new hotspot, fast rivaling? The number of cases are much less, but in growth rate, cities like Mumbai, Delhi, Chennai and now Bengaluru. Joining me for more on this is Professor Giridhar Babu. He's an epidemiologist working very closely with the government on tackling this. Also Dr. Vamanacharya, senior spokesperson of the BJP. Soumya Reddy, a Congress MLA who's been working closely trying to get corona patients admission in hospitals. Also RJ Jimmy, who is someone who's recovered from corona and is here to share his first-hand experience of this. Let me begin with Professor Babu. Sir, when you see the figures in Bengaluru and Karnataka, and I remember just over a month ago, this was seen as a success story because of the control of cases. What's changed? The lockdown has opened. What do you think is the biggest issue now that Bengaluru and Karnataka have to fix?
As the esteemed panelists will agree with me, the success of lockdown can only be seen that we have almost had no local transmission during the entire phase of lockdown. What started as importing from other states, now there is clearly local transmission going on in Bangalore with increased testing and also ILI survey for detecting influenza-like illness. There is increased detection of cases. The surge in cases is the natural progression of any infectious disease pandemic. So Bangalore had to get the surge at some point of time, and it has come at this stage now. It is most important now to reduce the mortality associated with the surge in cases. I think our focus has to be only that.
Right. Dr. Vamanacharya, if you can come in, because this issue of local transmission and the facts show that in latest numbers that most of the sources of transmission in Bengaluru are not known. So in terms of contact tracing, it's extremely hard because you don't know where they've actually got this disease from. What went wrong? Do you think people were casual? Do you think the government became casual? Because we've seen pictures from Karnataka, whether it's of weddings, whether it's of religious gatherings, where there's been no social distancing at all.
Most of the requirements regarding COVID, government has taken sufficient care. Government is quite active and performing. As Giridhar Babu has told, that immediately after lockdown opening, lot of people started moving in and out of Bangalore, and people coming together in different congregations also increased. Because of this, what has happened is the local contact and local expansion of the viral disease has increased. But one thing where preventing was one stage which we have done initially, but now it is spreading because Karnataka is one of the quite big states in the country, and still we are at fourth in the country. But now what is happening is we must look at the preparedness of the government. It has increased the number of beds. Today there was a very serious meeting of the cabinet wherein the government has warned private hospitals that 50% of the beds in private hospitals to be given to the COVID patients group. Now, today I have heard in the evening that the private hospitals have agreed from tomorrow onwards, more and more beds will be available for government to admit their patients in private hospitals. Not only this, at International Trade Center also, Trade Fair Center on Tumkur Road, there are many beds. But there are disadvantages of not having sufficient doctors to treat these patients.
I think that's an important point. In fact, I think NDTV covered also the opening of that COVID care center. But I'd just like to bring, sir, I'd like to bring Soumya Reddy in on this point, and I think all the panelists, because it happened in Mumbai, it happened in Delhi. We see the state governments all behaving surprised as if they didn't expect that corona was coming to them. Bengaluru, Delhi were later than Mumbai. So we saw what happened there. Why is it that these capital cities have not spoken to private hospitals, have not done these bed centers, have not arranged ICU doctors before this has hit it? Why do we wake up when the crisis is already happening around us and patients aren't getting beds? Soumya Reddy, go ahead.
Unfortunately, I really have to disagree. For the past 10 days, all I've been doing is actually coordinating with patients, their families, and the hospitals. The government hospitals have been completely full for the past couple of weeks, and the private hospitals supposedly are supposed to give 50%. but patients with symptoms, patients who have ILI, SARI are in fact running from pillar to post from one hospital to another, being rejected. And I'm sorry to say, but I mean, we were, Karnataka was at probably 9th or 10th. And, we are at, 5th place right now. And this is just, I don't know what today's statistics are, but yesterday we had beaten 27,000. And what's going to happen when we're going to hit, 50,000, 1 lakh? This is something that the government should have done 3 months ago during the lockdown period.
Exactly.
We have been seeing this in other countries.
No, I
Why
forget
didn't
other
you
countries.
prepare
It's been happening. In fact, Soumya Reddy, I agree with you. Forget other countries. It's been happening in other cities in India.
Exactly.
Mumbai should have been the wake-up call for every capital
Mumbai,
city
look at
around
Delhi,
India.
Look at Chennai.
I want to bring in a person
Ambulances.
who's not looking at this from an academic perspective in a sense, but I want to bring in someone who's actually been through this. RJ, Jimmy, speaking as somebody who's had corona, is now recovered. What was it like for you? And when Soumya Reddy was tweeting, we've seen those videos, our reporters talking about patients who waited for 8 hours for ambulances, a man who was turned away from 19 hospitals and died. Tell us, as a person who's had corona, what would you like to see change? Go ahead, Jimmy. Can you hear me?
Hello?
Did you hear me? Go ahead. That question was to you, that what would you like to see change?
In what?
In how corona is currently being handled in Bangalore.
I think that what had happened was, initially the government got in really quickly, and they did a really good job of keeping the virus down. I mean, flattening the curve. But once the lockdown was lifted and the restrictions were lifted, there has been a surge in the numbers. I think that somewhere along the line, the plot was lost a bit. And I think that, with respect to tracing, they were doing the tracing and the treatment really well. But somewhere along the line, I think they lost the plot a bit. I think it would be, using technology to just basically trace and try and contain the virus. I think that's what I'd like to see. Actually go back, not change, but just go back to what we were doing really well when the lockdown started.
Jimmy, when you see stories of people waiting for hospital beds, you hear stories of people being turned away from hospitals and dying outside. What would you say as somebody who's actually had it? What must change today?
I think that one is there needs to be a one point of contact saying, if I need a bed, where do I need to go? And I think currently the centralized approach towards this entire situation is not there. I think the sudden surge in numbers has taken everyone by surprise, even though you kind of knew that this was going to happen. So I think that because of the tech that is available to us, just the fact that at this central point that when I need a bed, I just need to check a central database and know which is the hospital closest to me. I think what the BBMP is doing currently is when they know that someone has tested positive, they're giving you a list of hospitals and saying this is where you need to go close to your area. And I think that there also needs to be more accountability from the private hospitals, because I think the government hospitals right now are running full with respect to patients that need critical care.
I think those are valid points, Jimmy, especially because you're in India's Silicon Valley, so surely tech can be a way to solve that. But I just want to ask Professor Babu. Professor Babu, some of the points raised, one is the fact that the government was really strict earlier, but once we opened up, somehow it seemed to be that life is back to normal. We can see that that's not happening at all. That's why perhaps cities are facing fresh waves. Also this aspect, why we didn't learn from what happened in Mumbai and Delhi, why was Bengaluru slow in realizing this whole private hospitals, getting them involved, getting more beds, why is it happening now after it's hit you?
So let me explain a few things here based on all the comments. The first thing is, no state can be immune without having surge in cases. If we are expecting Karnataka to stay in 10th place all the time, it's not going to happen. We have to have surge in cases, especially when you are increasing the testing. So if the infection is there, we have to detect so that we'll isolate. That is the first. Second, most of these people are asymptomatic and they deserve to be at least going through home isolation. Now, the Karnataka government has already brought in that. Third important thing, which I agree with Jimmy, is there needs to be a central coordination of allocation of beds for those who require oxygen. That's the topmost priority. The government was on its course, but then the surge occurred a week before their plans. So that's the reality. Fourth, why private hospitals did not come into the agreement? While the negotiations were going on, there was no agreement on the pricing of the services. By the time the agreement could be made, already the surge was there. That's why there was some delay in the beginning. But now things are on course, and I'm confident that Bangalore can get back onto its track.
Thank you all for joining me. As I think all the panelists have said, this is a battle we have to fight together. It's not about politics now, but very important points raised by all of you. Thank you. But Karnataka's growth rate still a worry, and I think that aspect, that why haven't private hospitals and been worked out the issue, the larger issue of our healthcare depending so much on private hospitals, is a cause of concern.